So you are an innovator and also a leader and educator and entrepreneur. So apparently you've led 23 different centers and 12 franchises, and you're the owner, founder of Integrated Peptides. But you have done so much in advancing different areas of medicine. And you have also gone through your own health journey, which probably helped you to be as driven as you are in seeking innovative therapies to really help people to suffer less. So, so happy to have you on the show.
But yeah, it was all really for selfish reasons because I could not function. I was, so sick. I couldn't practice medicine. Talking to a patient was just so exhausting. I had Lyme, Babesia, Bartonella. Was very evidence-based. I'm still very evidence-based, but go to the university doctors that you look up to and they go, oh, you must be depressed. I'm like, no. And they couldn't help me. But, in medical school, like a lot of places, it was drilled into us that anything alternative, integrative, basically was quackery, was no evidence. And so I believed that. So I wasn't going to go to these alternative conferences. But then I went into heart failure. And my heart, because actually with the Babesia and the Bartonella had high human chorionic growth factor beta, which caused fibrosis of my heart. So my heart would not fill, and it was just fibrosed, and it was terrible. I couldn't stand up straight. I couldn't walk upstairs, just sweating, like going 1 mile an hour, to nowhere. And so I'm not going to live like this.
Was it in medical school that you had this, or was it after you became a full-fledged? I know you were an anesthesiologist.
Well, that's why I went into anesthesia, because talking to a patient was so exhausting. I said, okay, maybe I can do anesthesia. They're asleep. You don't have to speak to them. But I forgot how you have to get up really early. But the fact where I'm just like, I could not function. Like, having Lyme is the worst thing ever. But heart failure on top of it is just horrible. So I was going to off myself on Halloween, and I said, well, I'll go around the world and look for treatments that, to help to cure myself. But if I don't, good luck. And so kind of went around the world, some great treatments. Like I went down to Puerto Vallarta and in the Lyme, Lyme, Mexico, and Omar Morales, awesome. I brought down Lyme antigens, and we basically cultured my white cells and stimulated them to the Lyme antigen. So we had this, the whole thing going. It worked really well. We tried to freeze it and use it multiple times. We screwed that up, but it was good. So a lot of treatments that worked, but they didn't last. And then I went through Europe and Belgium, and I did some peptides. I didn't really think anything of it. And I'm like, okay, I'll just do it. And then about 3 or 4 days later, I walked up the stairs. I'm like, wait a minute, what the heck is going on? No, it couldn't be a peptide. No, it couldn't be. And I went back and did them again. I'm like, oh my God, I feel even better. So, and kind of extended my stay from just like, doing all the peptides. I'm like, oh my God, this is amazing. It took about a year to get them into the US. And that's how I met Ryan at TaylorMade and said, hey, let me speak for you, get these peptides. And so kind of helped them. I mean, I'm not going to take any credit, but they're amazing. And just kind of set the journey. And it's really helped. I kind of in the back of my mind felt that, hey, this illness will be a good thing at some point. But when you're in it with Lyme disease and Babesia, Bartonella, it is horrible. And then heart failure on top of it. And, so the cardiologist said maybe in 10 years, you can get 10% better with just extensive cardiac rehab, right? And then so after about less than a year, I went back into his office standing up. He goes, oh, that's interesting. You get on the table, and they do an echo. He goes, it's pretty normal. And he goes, okay, see you in a year. He didn't ask me what I did. Didn't do anything.
He was not curious why you were doing so well.
You see it with these standard docs.
Wow.
But it's just like, and and I found when I'm sure you see this too, and if patients, multi-system illness, and they've seen 20 doctors, and they go, and you send them back to their doctor better. You think the doctor's going to be happy? No, they're not. It's a strange thing, but standard medicine, they're in a very bad system that they can't give good care. It's like impossible. And it's getting worse. So we'll see if anything changes here in the near future.
Yeah, it's fascinating because both of you and I were educated in that system, and we were really not equipped in getting people, well, to heal on the fundamental level. We know how to keep them hanging. There are very few chronic conditions that we actually have the tools to get them well. Acute issues, I think we're able to make some good.
Yeah, it's like if your eyes there, you get a broken leg, it's a good place. If you have anything out of the box, multi-system, forget it. It's just, if the doctor doesn't know what it is or how to treat it simply, it doesn't exist. It's the patient's fault. And we're getting sicker and sicker. We're the sickest country in the world, and we spend the most.
Yeah. So you now you're the rebel. But you're leading the rebel camp, which I believe is the mainstream. Some 10, 15 years down the road, that's just going to be.
Oh, I have to send you one of our proud T-shirts.